This is Call the Psychiatrist, the show where psychiatrists answer your questions. I'm Dr. David Handley.
And I'm Dr. Abby Snateley.
In this episode, we have two questions. The spouse of our first listener is insisting that he get therapy. Our second listener is curious about managing with her therapist away on vacation.
Say you like me, you better count the ways.
Just a quick reminder, listening to this podcast does not mean we have a doctor-patient relationship. Our intention is to educate and entertain you. Nothing we say is intended or recommended as a substitute for medical advice, diagnosis, or treatment. Always seek the advice of your own physician or other qualified healthcare professional regarding any medical questions or conditions. All right, our first question comes from Brian.
My wife has threatened me with divorce unless I get therapy. She is certain I'm a narcissist. I find her accusation offensive, but do not want to lose my marriage to my wife. We have 3 children. My family is important to me. My wife wants us to do both couples counseling and for me to find an individual therapist. It seems like a lot. Can you tell me your experience with situations like mine?
Yeah, Brian, this situation comes up all the time.
Indeed.
It's really interesting, though, because normally it's my patient in the office whose partner is refusing to come to therapy, so it's nice to hear from the other side.
Fair enough.
Yeah, there's I would say a significant number of people in my practice at any given time that should actually be in couples therapy more than individual therapy, but the partner won't go. Is that your experience, Abby?
Definitely. And there are times I'll even catch myself talking to someone and saying, well, we're acting as if your partner is in here, but really I can't do couples therapy with just one person. And I don't think it has to be either or. I mean, we can come back to his idea that it's a lot, because sometimes I think if, my patient, let's say, had a couples therapist, then we could focus more on their personal issues in their personal therapy.
I mean, obviously we're a big fan of individual therapy, but there's only so much you can do with one person when it's a two-party system that's not working.
As it turns out, all relationships are.
Yeah.
Right. Well, because even if it's just like, how do I get my wife to do this? Or how could I say this differently so that my husband responds? This is not about you making just the right moves to get just the right response. Like, we got to back up here.
It becomes this guessing game of like, well, I wonder if she means this, or I wonder if he means, like, you're constantly trying to then interpret a person not in the room.
What do you think his motivations are?
Yeah, right. You're trying to figure out what motivation and why that intervention didn't work. Wonder what she's thinking. Wonder what he's thinking. Yeah.
And then really we should step back and, maybe not just try to get the partner in therapy or couples therapy, but also, I wonder why you're choosing to stay in this relationship where none of your efforts are rewarded. But anyway, that's a whole other can of worms.
Yeah. Well, so, right. The short answer, I think, to Brian is that, you should try couples therapy.
And probably individual therapy.
Maybe, but I would say start there because...
All right.
I would start as a couple. I would put your energy into finding someone that you both like. I would make it a priority. I would make it work in your schedule. And then if you get curious about yourself, some interesting things may come up, and then you might decide you want to do individual therapy. But the reason I say that is because if you just did individual therapy, for example, that's not going to fix your marriage because you don't even know what the problem is. You need to go to the couples to try to sort out what is it that your wife is concerned about.
Right. I mean, I'm sure there's much more to this, right? This is a long marriage, at least long enough to have 3 children. But really what we know about Brian from the question is that he's offended and feels like she's asking for too much.
Yeah.
That's it, right?
Well, I am curious about, does it sound like an ultimatum? Because I'm guessing there have been some road signs along the way, some pleas for change or something, or there's been a crisis, like some explosive event that's happened that's threatening the relationship. But I think it tends to be the former. I think there's probably been lots of signposting along the way.
Yeah, no, I think that's fair. And I take your point, and I think it's a good one that, starting, it sounds like the marriage is at the point of collapse, maybe, or the wife is threatening divorce. And so focusing on the couple as kind of the basis of the family seems really important. But I am curious, for Brian, like, what's the resistance even just to the couples therapy? I mean, I don't want to say just, but he says this is really important to him. And so, I'm curious, like, what does he have to lose? Right? Like, why not try? It sounds like he might lose his wife. So whatever the risk or fear about going into counseling is, it seems like it's probably worth facing up to.
Yeah. I think some of the common resistance is going to therapy leads to separation or divorce. But I think in this instance, not going to therapy is going to lead there. So if you're
Right.
trying to pro and con this, I think I think the pros outweigh the cons if that's a concern that you have.
Right.
And I guess maybe to expand on that a little bit, just thinking about other ideas that people have or maybe resistance about couples therapy is that sometimes it does lead to separation, but often that's because one of the people already knows they want out of the relationship. And so they go to therapy as a way to let their partner down, or they have this fantasy
Right.
that if the partner's in therapy, they're going to come to the same conclusion that the relationship has to end. So they don't have to feel like the bad person.
That's fair.
And then
But
sometimes,
yeah, but I'm not sure the therapist or the therapy is causing it, right? I mean, like,
no,
obviously
no.
there's already trouble. So, that's I love to say talk about it, but I think you got to talk about it, man.
Yeah. And then some people come and they do the hard work of the therapy and they still realize it's not worth it.
Mhm.
But, sometimes they come and they get better and they feel more content and the relationship improves. So,
Yeah, and sometimes couples therapy is helpful in getting divorced, right? I mean, they're going to if this relationship is to end or the current iteration of it, they're still going to have to co-parent, etc. I'm not trying to, foretell anything because we don't know, but more communication and figuring out what's going on in this important part of your life seems kind of unavoidable.
yeah, I would say a positive outcome if you went to therapy and it still ended up in divorce is that at least you have some understanding.
Yeah, man.
Maybe the pain and
Right.
suffering is somewhat lessened. I don't know, but at least you'll at least have a sense of why the relationship failed, which could be really useful for you in the future.
Yeah, I don't think there's a problem with self-knowledge. I mean, I suppose unless he's a narcissist. Do we want to get into that piece of the
Well,
question at all? I
right.
mean,
I think being offended is probably okay. I don't know if he has narcissistic
I'm not
personality
against that.
disorder or not, but
Mhm.
everybody online seems to think that they know somebody in their life with narcissistic personality disorder.
Everybody, right? Well, and so, maybe this is a rant that is necessary or not. I mean, I think we've talked a lot more about narcissism in the last few years in the media and I guess in popular culture. I think the rise of our former president probably led to a lot of that, and people love to talk about narcissism. But now it's, I'm all for the destigmatizing of mental illness, but now this is being thrown around. If someone like takes a selfie, they're a narcissist, or someone does something you don't like, they get called a narcissist, like you said, online or maybe in their marriage or something else, instead of this narcissistic personality disorder. And it's just sort of like if people say they're depressed, I'm going to do a little bit more investigation and find out what that means, because like major depressive disorder to a psychiatrist is different than somebody feeling sad. But I think these get used in the same way.
Yeah. Well, here was my take on it for Brian. Obviously, we don't know if he's a narcissist or not, but let's
I think
just
every problematic boyfriend, girlfriend, spouse, partner is a narcissist, right? I mean, this is what internet culture has taught me.
But this was my take. Let's just say that he's not, but then think of all those traits that his wife is accusing him of.
Right.
I mean, so regardless of whether it's true, in some way she's communicating that, I don't know, that you either don't have empathy, that you use people for your fragile self-esteem, that you're self-centered, you're entitled, you're attention-seeking. I mean, none of it's flattering. So
no,
I
absolutely
think,
not.
So I would
not that he just has positive, healthy self-esteem, which
right.
there is healthy narcissism, people. This is what I mean.
Course.
But but we're sure she's not talking about a good version of that.
No, so I guess that's what I mean is if your partner has basically said you're a pathological jackass, I think the next question is, where's that coming from? Like, let me understand your perspective of it so that we can work on this, whether it's true or not.
Immediately negate the fact that you're a narcissist because you want to understand why she feels the way she feels. There you go.
There you go.
Check against narcissism, empathy, boom.
Well, and also I would just say that if she's leveling those kind of claims, I think the communication has just gotten to a point where she doesn't know what else to do. Yeah, and that she feels like she has to have a referee. Yeah, right.
My response has nothing to do with him. Yeah, she feels like she needs a referee, and she at least is motivated for whatever reason to see him or accuse him of, yes, being this fragile, power-seeking, unkind, unempathic person. Which, if that is the dynamic in the relationship, that definitely needs some work.
Yeah, so that's what I mean is either way, if it's true
Yeah.
or not, it's going to have to be explored. The downside is so minimal
Right.
that I think you got to go.
I think you got to go. I mean, or throw in the towel, but it sounds like your family is important to you, so it's worth a shot.
Maybe the last thing is it sounds like you had, I guess I give my opinion that maybe just do couples. He doesn't necessarily have to pursue individual. Did you have a different take on that? I thought you might, the way you.
I maybe the most basic top line is like, I'm not sure what he has to lose. I am curious about this accusation of narcissism and how deep that goes. Um, the question as it is written is pretty spare, and maybe if I think that is reflective of a sparse ability to self-reflect or whatever, like then maybe I think that he needs more therapy. Sometimes I think people feel a pressure in couples therapy, especially if one of the partners, maybe in this case the woman, is more emotionally articulate or kind of ready to go. I don't know if it may be helpful to have time outside of the couples therapy to also think about what he thinks and feels, if that's scary for him to do on his own, so that he comes into the couples work maybe a little more able to participate, because it sounds like she's way ahead of him in terms of what needs to happen. And so maybe I'm also nervous that he's going to kind of come into this like really far behind.
That's a really great point. Yeah, I see when the reluctant spouse comes in, they often feel they're being ganged up on, that there's a
Right.
triangulation and they're on the losing side. And so probably having his own therapist, his own support around that, so that he's trying to do the best he can without feeling so attacked. I could see that being really helpful.
Yeah, because I think, again, it's reading between the lines, but she may have been building her case for years, right? Like you said, it wasn't just one thing. If it's not a crisis situation, she may, depending on the communication in the relationship, but she may have been collecting her grievances against him or her evidence for his narcissism and failures for years. And if he hasn't been thinking about it, I'm not saying it's not like a court case where he needs to have it, but he just might need to do some catch-up work.
Dancing just you and me. Cha-cha-cha.
All right, our next question comes from Kenzie. My therapist is going on vacation for 3 weeks in August. I'm already dreading missing our sessions together. I want her to be happy, but I'm truthfully kind of upset. Sometimes I have trouble even getting through the week. I'm wondering what advice you have for getting through what will ultimately be a month without therapy. Also, I wondered if you could talk some about attachment. I'm so attached and wish there were ways to put this on hold. So, yeah, this is timely. We're recording in the summer, and Abby, you were just out of the country for a couple of weeks, so this is probably fresh on your mind. So, how do you approach people that might be feeling a bit more vulnerable?
I think it's a good question. And, for Kenzie, I think I feel for her. I mean, I know I've talked about this on the podcast, being on both sides of it. And I guess I just first want to validate that I think having these types of mixed feelings is totally appropriate. I mean, you say you want your therapist to be happy. I'm sure that is true. But it also sounds like you're feeling upset and vulnerable. I think people react in all sorts of ways to a therapist taking a vacation, or, for example, me taking a long vacation. It is a real relationship. We're going to have all kinds of feelings. I mean, for some people, I think it's relief. Some people are indifferent. Some people are annoyed. Depending on where the person's at or where we're at in the therapy, where they're at with themselves, like they may or may not express this. I, for example, had a couple cancellations the week before the vacation and a couple cancellations when I've come back, or no shows. And I think I'll try to explore that with each of those people. But for example, that could be a way to take back control, or maybe leave before I leave them. And then other people might be able to talk about their feelings a little bit more directly.
Yeah, it sounds like the main feeling is being abandoned.
I think that's right. And, what I was hinting at before with mixed feelings, I think there can be sort of a more intellectual, mature adult part of ourselves that is happy for the therapist, or recognizes that they need a vacation. I mean, I did kind of joke with some of my patients. It's like, you want me to take a vacation, right? Like, I'll be better when I come back. Like, this is, I promise this is good for everybody. And a level that you can kind of be on that, happy for the therapist, allowing them to live their life, But then there's the other part, the abandoned part, the sad or scared or vulnerable part. And I think some of the reason that doesn't feel good is because it feels younger. It feels more childlike, including that it's a repetition of an experience that I think is pretty much universal of when you're the kid, you don't get to control when your parent or parental figure comes or goes or leaves, or to be in charge of the schedule. That even when the therapist and the patient have been working as partners and colleagues, the second the therapist says, I'm taking vacation, and in essence, there's nothing you can do about it, it reinforces a power dynamic and probably runs the risk of bringing up old feelings.
Yeah. So what do you do? Like, how do you reassure somebody of their resilience? Do you have other interventions, or is it just a matter of preparing the person?
I mean, I have had supervision or read people over the years that say as soon as you know when your vacation is, you want to tell the patients, which can be hard to do because, again, people have all kinds of reactions, including negative ones. And then I had another supervisor that would say that once you tell someone you're taking a leave or a vacation, that it's pretty much like you're already leaving and you're already gone. And then everything between that time and then the break or the separation, and then for a while thereafter, is about that. So I try to have that in mind. And so, I mean, I think if I can bring it up early enough and we can talk about it early enough, or the person feels like they can express it, especially in words, if someone's expressing it in like no shows or cancellations, that doesn't really work. But if people are able to talk about it, I would want to find out what the vulnerability is. I mean, if it is, like Kenzie said about making it, or it's hard to make it a week without talking to somebody, then I always have coverage. Doctors always have coverage for someone, but I might say, here's another therapist that you could talk to while I'm gone, and reassure them in that way.
Yeah. I mean, I've obviously taken call for other doctors,
Sure.
and, I've been called before when it wasn't an
Mhm.
emergency, but the patient found it really helpful, even for like a 10-minute chat. And I think the therapeutic benefit was just knowing that somebody was available, that they had not
Right.
been abandoned.
Mhm.
And sometimes there really is a crisis. And I think in that setting, it's helpful because they know that I have a relationship with their psychiatrist. And so I'm going to fill them in. We're going to close the loop. They're not going to fall through
Yeah.
the cracks. And I think that's really reassuring. So I think Kinsey could probably ask about what the coverage looks like.
I think that's good. Yeah, and even in this recent vacation that I took, I had someone who had a death in the family and was just feeling, yeah, like you said, a little unsteady or precarious, and it was important for that person to know who they could call, and that person would have the outlines of their situation if they needed help. And ultimately, I think that was enough. They didn't reach out, but to not feel like the person's just floating, that there's nothing, right? I know people, and I'm sure they've done this for you, people might call the voicemail to hear my voice. I have had people who keep journals, or I don't check my email when I'm on vacation, but who will maybe send me emails of updates or their thoughts as if we were having sessions in between, to feel connected in a certain way. That's kind of a compromise where they feel like they get to be communicating with me, but not intrusive. And then I can read it when it's like my time to read it. In some cases, people will want something from my office, kind of a transitional object in between. But a lot of it, I think, is this process of us as the therapists keeping the frame and being there and coming back, whether it's coming back week after week or after a weekend, coming back after an illness or a vacation. And hopefully, if Kenzie can talk with her therapist about this, hopefully this is part of a reparative or healing process where over time she does trust that people can leave and come back.
Hey, say more about, I mean, I've definitely, had the people calling for the voicemail. I think the
Mhm.
journaling is a really great idea, whether it's email or just your personal journal. The
Right.
transitional object, I have not had that come up.
Um, I would say most commonly maybe a book,
Mm,
right? Something
mm.
that they've noticed on my shelf or something that they would like to borrow. I've definitely read case histories of people taking trinkets or paperweights or things like that. But yeah, I suppose I'm trying to think specifically. Once a blanket, which was kind of a big deal, and the other times it has been a book.
Okay.
I don't know, it's kind of boring, but I'm like, I
Yeah.
feel like if otherwise it gets kind of too personal
Yeah. No,
of
that
like
makes
what it
sense.
means to that person. Yeah.
Sure. No, that makes sense.
My office is messy. They can't just like take a random stack of papers to remind themselves of me. Like,
Well, I was just thinking my office is so Spartan. I just don't have anything to give away.
oh, okay. I spent a lot of time there.
was
Yeah,
like,
that's fair.
My shoe.
Yeah, right. Like some Kleenexes. Yeah, there's not a lot. But sometimes people sit there, week after week or year after year, and they've looked at the same thing over and over. Both to have something, I guess, to remind them, but also if they think it's valuable to me. I think that in the case of the blanket, the person was sure I would want it back. And it was hard. It wasn't hard, but it was in that point, we didn't have enough time to have her believe that I just wanted her to come back.
Mm-hmm.
So it was like she almost was holding my blanket ransom. But I had to take them both back, just in case I went on vacation and like decided to stay away forever.
Mm-hmm.
And I am better. This is the other point I want to say though. Like I enjoyed, felt more engaged. I don't know, felt a little more on and tuned in this last week when I came back from my trip than before. I mean, I am a advocate and enthusiast of vacations for everyone, including myself. So that, I mean, I guess that was another example I thought of, is I think some people might be judgmental, maybe and because of pandemic things about me traveling, but judgmental either because they're a workaholic and they don't think people should take vacations. Maybe there's some envy or jealousy. Maybe there's some things like that. So I also think there's an aspect of modeling self-care and having these kinds of boundaries to take vacations for myself, take time off for myself and my family that maybe people don't like, but if you believe in that aspect, I think it's important.
Mm-hmm.
Though it is a reminder that I have a life outside of the office too, right? I mean, which is
threatening. Yeah.
Which is threatening. Yeah.
Yeah, and maybe this is just me. Maybe I shouldn't disclose this because it's maybe I'm too organized around guilt. But I actually feel really bad when I have to leave, not necessarily for a scheduled vacation, but anything that's unplanned. Like there's a sickness in my family or a death in the family,
right,
and I have to be away. I rarely take any time if I'm sick, but I had COVID not too long ago and I had to cancel people, and I actually feel really bad about it. And I'm assuming Kenzie's therapist might have the same feelings. I think you're right, though. Usually a planned vacation, it's a little bit easier to.
But to be totally clear, this was no small achievement of my own therapy that I could take vacations and not feel bad. Okay. And take more than a couple days off. I mean, this is like, I say it in this way, but I mean, it's a real point of pride to me that I can do this now, and not tie myself up about it. And I mean, and it's embarrassing, but I think, in the past or when I was earlier in my career, I would drag my feet sometimes about telling people, even if I was really excited for the vacation, I guess because I didn't want to. Not necessarily because I didn't want to deal with it with them, but yeah, because I felt guilty. Where I'm saying I'm putting my needs above yours, which is the agreement that I don't do that, at least when we're in the session.
Mm-hmm. Yeah, I was definitely that way early on where I would delay. And I think it's because I had a fantasy that if I just had one more week, they would be better. They would be better able to handle the separation. Which was not, again, I was just fooling myself, but yeah, I can relate to that.
And then some people are like, sweet, I get a break. I'll save some money. Like like we all win. And I don't know. And I guess a relief, like a break is not all bad. I mean, I think for some people we came back and kind of hit the ground running. And for some other folks, it's a little more warm up time.
Yeah, I think a lot of people are surprised at their own resiliency. Like they may go into it with feelings that Kenzie has, and then you get back and they're like, you know what? It wasn't that bad. My dependency is not as strong as I thought it was. Which I guess that gets to Kenzie's last question. She used the word so attached. I mean, I'm kind of, I read that as more that there's a feeling of dependency that feels uncomfortable, that she's not going to be okay. And that's not an uncommon part of therapy, of having those feelings early on.
And learning that it is okay, right?
Yeah.
I mean, and like I said, that I bet the therapist will come back and, hopefully they can figure it out to keep moving.
Mm-hmm.
It doesn't feel good. And it sounds like she wants to follow the rules of nice, polite society where you just tell people you're happy for them for having a vacation. But it's just more complicated than that. But I can almost guarantee, Kenzie, that your therapist not only has heard it before, but, hopefully welcomes this, because that is why therapy is different than your friends or polite society, right? Ideally, it's a space to explore all your feelings, even the conflicted ones or the unflattering ones.
Yeah. You get to talk about how angry you are that she's leaving you.
Yeah.
And how could she do that? And I thought we had a deal, and I'm not better yet. And all that's fair game.
Yeah, 100%. I mean, someone who I have done a lot of good work with was so mad I was having a baby and was yelling about F me, F my baby before I went on maternity leave. And we worked through it. It's okay. He was just jealous.
When you left for leave, did anybody see somebody else while you were gone?
Yeah, definitely. And some for kind of medications or things like that. One person who did have a hard time with me being pregnant, and they had some life events that made them particularly sensitive, saw another therapist and didn't come back, kept seeing me for medications, but decided to stay with them. And that was a complicated one, because I think, as we're saying, talk about it, but I was pushing on this person. Let's talk about this pregnancy. Let's talk about what this means. Let's talk about what the break will mean. And he couldn't, or I didn't make the right space for it. And we just kind of never got there. And then afterwards I contacted him and he said, I don't want to come back. And I said, I think this is what this is about. I think we could work through it. And he was kind of like, no, thank you.
Wow.
And I know I heard him with that and that leave. I'm not saying that he didn't go on to do good work with the other therapist, but sometimes the pain of these separations is too much. But I guess I would encourage Kenzie and everyone to at least kind of give it a shot, because I think endings, abandonment are inevitable parts of life. And so if that's an opportunity to work on it, then great.
Yeah, that's great. Well said.
Thanks.
Maybe my final thought, just a little bit of history, just because it's kind of fun. But, in analysis, the patient was always encouraged to take a vacation when their therapist took vacation.
Oh, yeah.
So I don't know if people still do that.
I've seen people, maybe East Coast people, like write about it or talk about it. And some of that's in the space of, this is your weekly spot and you rent it except for these weeks and blah, blah, blah.
Right.
There's also the long analytic tradition of taking the whole month of August off.
Right. That's why I thought this was so appropriate, that this therapist is leaving in August.
Yeah. But I've also had, this is sort of related, I've also had the experience of going to work on a lesser holiday, right? Some sort of federal holiday that I think is not that, that, I should work. These people need me, blah, blah, blah. And then it's like 20% of the patients even want to come. Like, you know what I mean? And that's a real lesson in like, who is this more important to too? So, that made something. And in the summer, a lot of my patients are traveling too, but I guess maybe around like the winter holidays and Christmas and things, it's become easier for me to work less, just in part because, even if people are flipping out about their families, they don't necessarily want to meet with me. There's always time's on our side.
Yeah. Yeah, no, I think that's true. I think a lot of times, again, as we talked about, some patients find that the break is really not a big deal. They're more resilient. They're better. They don't actually need you. They actually is a conversation about frequency. Actually, we don't really need to meet every week anymore.
Right.
Or then the priorities
and then you have
different.
to say, are you angry because you're protecting yourself against sadness? Are you right? There's always stuff you could analyze in that.
Right.
Are you better because you're in denial? Like,
keep them on the hook.
Right. I just thought I'd give you, since we were sort of, caricaturing analysts, I just thought I'd give you some of that too. Never let you out.
Well, right. That's why it lasts 10 years.
That's right. Yeah. It's a short one.
All right. Well, big thanks to Brian and Kenzie for taking the time to send in their questions. And we thank all of you for listening. Please send in your questions by email or an audio message at our website, callthepsychiatrist.com. And we'd love to see you on Instagram and Facebook at Call the Psychiatrist. And if you've gotten any benefit from the show, we'd really appreciate it if you'd write a review wherever you listen to the show. All right. Take care.
Bye.